This message is for those of you who were unable to attend the talk or who had to leave early because of work requirements, and I must say that that is exactly what I was talking about, that some of the challenges for us in the healthcare environment have to do with the fact that we have many responsibilities that often make it difficult for us to do the kinds of things that we would want to do. And for that reason, I'd like you to have the opportunity to hear some of the key points that I stressed in my talk today. So I was really talking about some of the challenges that face us in the healthcare professions today as we have so many advances in the art and science of medicine at the same time that we have a lot of challenges for the healthcare workforce. So I'm going to talk a little bit about the difference between burnout and depression, how they're connected to each other, what some of the factors are that happen systemically that affect all of us. Burnout is a concept that relates to the impact of issues that are driven by the healthcare system itself and experiences that people have individually in response to that system. So some of those have to do with emotional exhaustion, feelings of depersonalization, feelings of anger, feeling upset, and we're trying to look at what some of the systemic causes of burnout are.
Well, a very clear message came through for me today, and that was as we think about well-being, as we think about developing resiliency, that it can't just be an add-on to what we're already doing in our lives. We have to make it a priority, but more importantly, something else has got to go. We have to make time and space for these kinds of activities, and so that we can develop an environment that's conducive to well-being and resilience, but also working on it ourselves individually.
What I came away with was, it's not just resilience that we want to look at, we also want to look at resilience and perseverance. So you put those together and you have grit, you know? So medical school, nursing school, dental school, it's all really, really hard. So you need to be able to push through. When you know, that's perseverance. When you get knocked down, you pick yourself up, brush yourself off. That's the resilience, and then you push through. So you have this idea of grit that I think is so much stronger than each of the two separate constructs that make it up.
At the same time, we really want to be mindful of the issues that affect that have to do with the individual response to burnout. So different people will respond differently to challenges in the environment, and some of us may feel burned out at a particular point in time, and then subsequently they're going to feel much more resilient. So you may feel burned out for a week, take some time off during the weekend, and feel recharged and able to go back to work. We have tried to address some of the issues that are broader in the general context, and those which may have to do with individual factors that have to do with our makeup, our temperament, our support systems, and our past history.
We really have to take out something to put wellness in, because if we just add wellness and that component to our everyday workings, it's going to stress people out even more. So that to me was, I never had thought of that concept before, that we have to actually remove something to put wellness in.
And finally, we're going to try to look at some of the solutions that people have looked at to address challenges in the work environment that make it more difficult for people in the healthcare professions to do their job appropriately and well and take care of patients. There are a number of these out there. A lot of them relate to mindfulness exercises, building time in the workplace for self-reflection, trying to have opportunities to really focus on meaning in medicine. All of us have come into this area of work in order to connect to patients and help them feel better. And the more opportunity we have to do that, the better.
While we think about resiliency, we think about wellness and well-being, we probably are all guilty of not taking steps personally, and we've got to be doing that personally and be role modeling that in order to, again, establish that environment that's going to be conducive to well-being and resilience.
One of the things that really struck a chord with me is how I am modeling resilience to the people that I work with. And so the sending of an email at 3 in the morning, I'm very guilty of that. The answering emails and texts, and on my vacations, I'm guilty of that. And it struck a chord with me that I am actually modeling how to be resilient and how to have wellness to those around me. And so it was convicting, but also challenging personally to be a better role model to the trainees that I work with, to the staff that I work with.
So please pay attention to how you're feeling, what's going on in your personal life, what's going on in the work environment, and take a few minutes every day for some self-reflection about what's going on.
I'm going to take back to the College of Dentistry, faculty, staff, and students the importance of our environment and demonstrating to each other that it's okay to take care of ourselves. The importance of sleep, nutrition, trying to de-stress, all of those things are extremely valuable. And how can we work together as a community to have a healthy environment?
I think I'm going to schedule actually a time to hear from some people, just to sit down and actually dedicate some time in the day to hear from them on what aspects of their job actually do cause the most stress, because that's something that I've never asked any of my staff. And so I think that that will be the first thing I do.
Those are some of the things that I've tried to cover in the talk, and I hope you will enjoy hearing more about them.